Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas. We are back with more talk about ReActiv8, a functional neurostimulator for treating low back pain. I'm going to first play a video to preface the therapy on how our brain controls our low back muscles before bringing on our special guest today. So let's check it out.
In a healthy, functional back, the brain sends motor control signals to the back muscles, while the back muscles return sensory information in order to perform everyday activities. This communication loop between the brain and muscles is called neuromuscular control and consists of muscle recruitment and sensory feedback called proprioception. We use neuromuscular control to consciously control our superficial back muscles when doing things like exercising. Large muscle movement activities like bending over to pick something up is consciously controlled from the brain. We also use neuromuscular control to subconsciously control our deep stabilizing muscles for smaller micro movement or stabilization activities like brushing teeth over the sink, washing dishes, reaching up for something, or having to maintain a standing or seated position for an extended period of time. Large movement activities utilize the outermost superficial back muscles, called the erector spinae group, which are most often controlled with our conscious thought. Critical spine stabilization during movement activities utilizes a deep multi-layered core muscle group called the multifidus muscle group in our lower back. This stabilization is automatic and is mostly controlled subconsciously. Neuromuscular control can become muted or inhibited due to injury. This causes our brain to send little to no signal to the muscles, as well as ignore important proprioception from the muscles. This results in our muscles failing to properly function to stabilize our spine and spinal column correctly. This muted or inhibited communication loop can cause excess muscle fatigue, improper loading on spinal joints and discs, resulting in mechanical chronic low back pain. This cause of mechanical chronic low back pain, stemming from the loss of neuromuscular control and multifidus dysfunction, is often misdiagnosed and can be confused for other back pain pathologies.
Great. So Dr. Dan Nguyen is our special guest today. He's an interventional radiologist that specializes in pain medicine. As you know, Pain Diaries is a show to help people understand the options that are available for treatment. There's so many amazing technologies available, and today we have Dr. Nguyen here to discuss everything about ReActiv8 and chronic low back pain.
Well, thank you, Dr. Mancy. I'm excited to talk about this new treatment for chronic low back pain. As you and many other specialists in the spine, we have tons of patients who wander through life with chronic low back pain, try everything under the sun, including physical therapy, injection therapy, and medication. And despite all those trials, they continue to have low back pain. Recently, we have discovered some potential source of this back pain in terms of the multifidus muscle of the low back, and we call it dysfunction, where, as you saw in the movie, there is a disjunction between the neurovascular communication with these muscles. And these muscles are the greatest stabilizer of low back. And with the lack of coordination, it resulted in further, kind of damage to the low back and causing chronic low back in terms of disc herniation, degenerative disc disease, joint degeneration, and all contributing to this low back pain. It was through the discovery of the importance of these muscles recently and led to a large clinical trial where they show advantageous using this treatment to treat these chronic low back pain. To date, we have 3-year data showing increased efficacy over time. It's not just a one-time. Over time, it has increased efficacy, decreased pain almost 70% of patients who were in this trial have, over the 3-year period, have gotten significant reduction in their low back pain. To almost 70% of those have voluntary or to stop taking their pain medication because the treatment is so effective. So I'm very glad to be participating in this introduction to this new therapy to the patient with this chronic low back pain injury.
The treatment has been very amazing for a lot of people and life-changing, especially those people in the study, after those 7 years were up, they really didn't want to give up the device because it was so helpful to them. I really wanted to get your take as a radiologist. I mean, you've been practicing for a while now, and you've served as in academics and now private practice. And back many years ago, there weren't really many comments about the multifidi muscle and the atrophy of those muscles in patients. What would you say has triggered the change in now looking at the multifidi muscle as a source for pain?
That's really important you just said that, because I think we as radiologists, we have a lot of things that we can interpret, and the most difficult part is what significant it would report this. First the finding, and then number two, is there anything we can do about it? So I think that has led to certain maybe underreporting of the findings of multifidus muscle. I think with this treatment, I think this is going to be very important that we need to observe the muscle and report on the findings of either fat replacement or atrophy of the multifidi along the low back.
How would you guide patients, if they were watching this show and they learn more about ReActiv8 and they're like, well, do I have multifidi atrophy or do I have fatty infiltration in my muscles on my MRI? So what would you give as specific advice for people that have chronic back pain and who've had an MRI but have yet to been offered this type of ReActiv8 therapy for their pain?
Yeah, so I think if you're one of those patients who has gone through the last months or years with chronic low back pain, I think it's important that we want to make sure that you don't have anything else. There are other things that emulate or cause low back pain. So in combination with on the MRI of the multifidus muscle losing volume, there are other physical examination that a spine specialist can perform to kind of bring out this dysfunction. And in terms of the positive instability test and the multifidus muscle lift test, and in combination with the physical finding and the MRI finding may lead down to this offering of this treatment for them.
Oh, for sure. And I know a lot of times, as a spine specialist myself, I look at my own MRIs. When a patient comes in, I make sure they bring the disc because I want to make sure I'm not missing anything. And I would still say about 50% of the time, radiologists are not commenting on that multifidi atrophy or fatty infiltration. And so I think it's very important for us as doctors to look at MRI scans as well to make sure, and we're working with our local radiologists to ensure, everything is included in the report, whether it be clinically significant or not to the patient, because now we're knowing that more different findings can lead to different types of symptoms to the patients. So how would you propose that doctors that in your practice and around the country incorporate this into their practice?
Yeah, that's very important that we're trying to bring this message to the into society that deals with the spine. I think that's one of the places we can look at doing it in a local level with our peers by bringing on this concept of multifidus dysfunction, and the treatment and the imaging findings. And I think through that effort in a more local level can lead to a widespread adoption of reporting this in the MRI. I think I encourage anyone who provider in your local area that are familiar with this thing to reach out to the radiologists to tell them as well about this treatment and how important the recognition of multifidus atrophy would be on the report to document on there.
Absolutely. No, I completely agree with you. I just feel like it's important, especially for patients that do and qualify for the ReActiv8 procedure through Mainstay Medical. It's really important to document these kind of things because we want to make sure that we're following the guidelines set forth through the studies that have been done. Plus, we want to be able to have the patients access to that care. And insurance companies have a bunch of checklists and things like that, and these are all important things that we need to propose and show the insurance company, hey, this patient is a good candidate for this procedure. And hopefully with time, they will start adopting these therapies as more of a mainstay in their algorithm of allowing what patients can have to treat their chronic low back pain.
No, I agree. I mean, I think the insurance community has a job to do, but sometimes they may not be update in all the treatment. So for us as provider, it's a recognition of this entity and submit this treatment to the insurance. And you may not get the first time or the second time or even third time, but if through repetitive submission to this insurance company, over time, they will see, wow, okay, there is something else that we should be looking at and should be offering to our community. I think that's probably the best way to approach it.
No, for sure. Anything else you think patients need to be aware of when it comes to their multifidi muscle and how to keep them strong and what they need to potentially propose to their primary care to be referred for this revolutionary technology?
Yeah, I think there's exercise and good health. Global well-being is important to your health. I think if you're one of those patients that have been through many provider in the past and have yet achieved the outcome that you desire, I think it's one of those things you could probably, if you're watching the show, is go to the Mainstay website, and there is a physician finder there that you can look at your local area and see who is familiar with this treatment, and maybe seek them out and see if you're one of those patients that has all the findings and that may lead to this treatment. I think that's probably the best thing I can recommend for everybody who suffering this terrible chronic low back pain state.
Thank you, Dr. Nguyen. Yeah, I would advise anybody in Oklahoma to seek you out, and here in Houston, Texas, both me and my partner are trained in this procedure. So, we're really excited to offer this new technology to patients, and people have been doing great with it. It's really a game changer in the space. So thank you so much for your time and being here with us on Pain Diaries.
Thank you again for the opportunity to be in your show today.
Absolutely. Talk to you soon. Thanks for being here. This is Pain Diaries, and we'll be back after a commercial break. I'm Dr. Suzanne Manzi. Take care of you so you can take care of business.